Hi, everyone. Welcome. We'll get started in about 2 minutes. Welcome to today's virtual discussion. I see some people are joining us now. And if you get a chance to use the chat room and let us know you're here and tell us where you're from, we'd love to say hello. I see JC Cruz. Welcome. Hi, everybody. Thanks for dialing in. We'll get started in just about a minute. I hear bells this time. I don't know what that's about.
That's pretty good.
That's Catherine putting her things on mute.
Okay, I was going to say it is a communications webinar. So
Yes.
Hello to Ben Felice from BM Clark Public Utilities. Thanks for joining us. Again, if you want to say hi while we're waiting for others to join us today, feel free to use your chat box to let us know you're here and where you're from. Hey to Crystal Jones, also from Clark Public Utilities in Vancouver. Welcome, Vancouver, Washington.
So Catherine,
Hey,
first
from Damon, also from Clark Public Utilities. This is our third person.
So Catherine, first day back, how was it?
It was work.
My daughter, husband, and 3 kids under 5 moved out after a year or plus on Friday, and it's been so quiet in my house, right? It's so funny. I was teasing Laura. I'm on so many webinars. My granddaughter thinks this is where I live.
Oh, you mean with the bridge behind you?
This is Pop's room. Many times, Laura and I would be talking with a webinar, and she'd come. I wouldn't hear her. She'd come, and next thing I know, she's in my lap, saying hi to everyone. I think COVID had redefined meeting decorum, right?
So hey guys, I just want to say also we have Sean from Vancouver, British Columbia, and also Matt from Epicenter Innovation in Denver says hello. And if you guys are ready, I think we'll go ahead and get started. Yeah. I have that it's time now. So welcome everyone to the All Hazards Consortium Business Resiliency Virtual Discussion Series. This is about our 15th or so conversation on how COVID has affected various industries. And today we're going to hear from the communications industry. I'm Laura Johnson. I'm the Director of Conferences for All Hazards Consortium, a nonprofit association. Just a couple quick administrative announcements before we get started. First, feel free to use the chat box to say hello or ask questions or make any comments. You can also submit questions through the Q&A feature on Zoom. If you just hover your mouse over your dashboard, you should be able to find that pretty easily. We welcome your questions. We'll have some time at the end of today's webinar to address them. And even if we have more time after that, we will unmute everybody and ask you to say hello in person. I also wanted to let you know that we are recording today's virtual discussion. So we will forward that to you once the webinar concludes. And you can use that to forward to any of your peers or colleagues or to listen again if you want. So that'll be sent to you automatically. And I'd like to introduce our Executive Director, Tom Moran. Tom?
Hi, Laura. Hi, everyone. Thanks for joining us. These have been a series of webinars that have just been really fantastic. Today, I've worked with Kent and Catherine for quite a while on many different areas and topics, so forth. So you got some of the best in comms. I came out of communications, so I retired in 2003. And like everything, this is a great opportunity for us to capture what's in people's minds fresh following the COVID pandemic. And now we're all moving into what looks like an active hurricane season. So I want to thank our panelists and thank you all for joining us. So Laura, I'll turn it back over to you and we can kind of jump in. I guess, you got my slide here. So you may hear us reference the sites. People say, what is that? So on the phone today, Kent is actually the chair of the SICE working group, which meets every Friday and has been for several years now. The SICE is a legal framework that protects information and vets identities, and then organizes that information by use case for problem solving and decision making, rapid decision making. So it's run by the private sector, and it's used to expedite the flow of information into operational decision making. So you can register that for free at siceusa.org. And if you hear that, that's what the SICE is about. So we use that to house information and stuff and the videos and things like that. So you can register, it's no cost. It's a way for us to vet and build a trusted community of people nationwide from all different sectors, government, industry, so forth. So Laura, I'll turn it over back to you.
Okay, thanks so much, Tom. I'd like to introduce today's panelists. We have Catherine Condello, who is the Senior Director of National Security and Emergency Preparedness with CenturyLink. And we also have Kent Kildow, the Director of Business Continuity and Emergency Management from Verizon. I'm going to start with asking our panelists to introduce themselves. And Catherine, I know you had a few slides that you wanted to show. I was unable to import them into mine without losing the integrity of them. So what I'm going to do is quickly stop my screen share and switch over to your slide and bring those up right now. There we go. So Catherine, hi. I just wanted to ask you to introduce yourself and tell us a little bit about what you do.
Again, Catherine Condello. I do work for CenturyLink. But today I'm going to be talking to you from a slightly different worldview. I'm also the vice chair of the Communications Sector Coordinating Council here in the United States. And that's for my friend Sean Magnuson, who lives in Vancouver, British Columbia. By the way, my son lives in Danbury, so you're quasi neighbors as far as I'm concerned. At any rate, and what I'm going to be talking a little bit about to do sort of as a preface is sort of talk about what the sector as a whole did through early days of COVID and going forward. I am the liaison there to DHS for Emergency Support Function 2, myself and my associate Chris Anderson, and do work in the sort of public-private emergency response space. Kent?
Good afternoon, everyone. As Laura said, my name's Kent Kildow. I've been with Verizon for about 25 years now. First in field operations, and then in network operations, and most recently in business continuity and emergency management. My team has responsibility for our global program for all hazards, and look forward to talking with everyone today.
Hey, Ken, thank you so much. So we have about 6 questions that we're going to ask our panelists today. And Catherine, I'm going to start with you on our first question, which deals with the operational impacts. If you could please describe the impacts that COVID is having on your organization. I know we're 3 or 4 months into the pandemic, but if you can tell us, what are the current challenges you're facing?
Would it be helpful if we sort of did the recap now, and if you went to the other slides, and then we can kind of bring it up to today? Does that work?
Yeah, let's do that. So let me switch back to that, and
because she's totally on top of all this back and forth thing.
No problems, no problem. All right, let me go to screen. There we go. Okay.
So again, I'm going to be talking a little bit more broadly, not just about CenturyLink, but even Verizon and everybody else on there. I know we're sitting just as we're going into August, but I thought it would be helpful to sort of do a quick historic snapback, if you will, to late February, 1st of March, so that I could give to you sort of a feel for sort of what the stages of activity were for the communications sector broadly. So we, within the sector, we kind of use March 9th as the date. I don't know why, we just do. We're using March 9th as sort of like, oh my heavens, we're now in this. And what we found ourselves in is because people were really scurrying. And so for those sort of 2 weeks, the sector as a whole, in particular, any of the wire-bound ones, the cable guys, the wireline guys, there was a huge, huge, huge flurry of activity from people who were all of a sudden dusting off their pandemic plans and realizing that maybe they needed to up their capacity to be able to do the work from home or whatever it was they wanted to do. And even in those very, very early days, at least here in the United States, we already had what we called our access letters, which we get from the DHS National Coordinating Center, which is where we coordinate everything. But in those first 2 weeks, there was also a big flurry of activity about, really, are you critical? Because we were using these access letters in places like, let's say, Iowa or Montana, where then they're not accustomed to seeing them as they are like in hurricane territory. So we were already starting to get in these very, very early days, who's essential, who's critical, and we had to start working on the folks, we're still working issues. As we moved into like March 23rd, March 30th, other people were starting to like fully start to engage their work for home. And speaking as a communications provider, we took, I don't know how many thousands of phone calls from customers at the consumer level who were going, how do you work this VPN thing? How do you work this Zoom thing? Now, mind you, it wasn't my VPN. It wasn't my Zoom. This was something they were using for their, but still tons and tons and tons of calls where we were working with end user customers on, sort of how to do this kind of thing. It's at this sort of time frame also in sort of the March 23rd time frame where we start to see the criminals pivot. Oh, we're not going to do social security number. Oh, we're not going to do IRS stuff. Let's do COVID stuff. At this point, access issues are also continuing to be an issue. And it's not just for us, but it's for all the sectors. And there was a lot of back and forth and back and forth and back and forth about, does it make sense to get in our case, we use a DHS letter to give to the state folks, or do we need state letters? And there was a whole bunch of political brouhaha around the delivery of what became the DHS CISA Essential Services letter or Essential Services Notice. It's also at this time as things are really starting to ratchet up where I think the sector as a whole, particularly for those that live in the Washington, D.C. area or do state government affairs, we're getting countless phone calls from entities, whether it was departments or agencies or major customers. Is there enough capacity? Are we going to run out? Of course, the answer was yes, but that was a lot of, if you will, stuff that we were dealing with to be able to communicate and educate. In April, the schools started to use their distance learning tools. And also in April, there was a huge push amongst the sector across the entire United States where CDC and HHS were looking for alternative healthcare facilities. So while we're out adding capacity or we're answering phone calls, whatever, we were also doing on what I'm called field trips. Will this school work as an alternative healthcare facility? Is there service there? Can it be bucked up? So we were getting lots and lots and lots of gratefully sort of funneled through the FEMA regions and through DHS sort of we're looking at these 12 spots in this state. Does anybody know about them? At this point, the messaging about the we're still working was still, dealing with access issues that continue to bubble up. But there was also a lot of dialogue about to what extent could there be common federal and state criteria. CenturyLink, who at least the people in Vancouver, Washington might know is sort of a local provider in Washington state, but not everybody knows, CenturyLink in, let's say, Iowa. We are in all 50 states, but we're not the major local provider like Verizon is on the East Coast. So, having this kind of common federal criteria for us as CenturyLink, where I'm operating all 50 states, would have been really helpful. And that was a continuing dialogue. We discovered that permitting at the local level was an essential service because if someone needed more service, I needed to go someplace and I needed to be able to get a permit to put something like on their roof or on their tower. And so permitting as an essential service became an issue. And it's also during this time where the whole source of PPE and face masks was, well, it was a big issue. Finally, mid-May, we actually have already pivoted at that point into the new traffic normal. So March 9th to mid-May, huge churn of activity. Go ahead, Laura. So let's talk about what the performance was. This is a diagram from the National Cable Television Association, the cable folks. And it's a lovely graph and it actually kind of roughly represents sort of what we saw on the wireline side as well. If you sort of look from sort of the March 9th on up, you can see a huge surge, sort of roughly in the, let's say, 30-ish plus up rate, and that's on upstream. And then on the downstream side, a huge surge sort of in the 20-ish sort of range. And you can sort of see how it upped, and then sort of and it's now starting to come back down again. What is important to note is that this big surge, even on the top level of it, the capacity of that service was still above it. So in essence, whatever the surge in traffic was still lower than what your normal sort of 8 o'clock at night when you're doing whatever you do at home sort of service. Now, I'm not trying to say that capacity wasn't built out and extended throughout the entire sector and by everybody, it was. But in general, the surge, even at its high point, was still lower than what you would consider to be peak time, 8 p.m. local time.
Wow, I didn't know that.
Go ahead to the next slide. Now, in contrast, the wireless guys saw nada, flatline, flatline, flatline. Now, what was different about the wireless guys is that while, I'm not trying to say that the wireless guys didn't change their service, but you can see the variations in the upload and download of this stuff, in essence, stayed flat. What they saw was that, yes, they're still using their wireless service, or they're using sort of their MiFi, Wi-Fi kind of thing. The biggest change in the wireless service is that if the average person generally jumps, let's say 6 to 20 handoffs a day, it went from like the cell site you're in to the cell site of your adjacent neighbor. That was the big swing in the in the change. Next slide. And if you like numbers, once again, in TCA to the left are these small telephone cooperatives, of which there are over 1,000 of them in the United States. And then in CTA, again, the cable guys off to the right, give you some flavor for what the traffic looked like. So once again, in TCA, talks about 24% increase in overall downstream and upstream, 21% increase in peak downstream upstream. No material shift in peak utilization. Once again, that 8 p.m. sort of thing, it was still kind of, I'm sorry about doing it backwards, but this traffic sort of like, and in essence, what you handed, instead of seeing a big zook hockey stick to get up to that 8 p.m. sort of thing, what you did see was sort of a big shoulder where traffic got much higher, and then it still went up to the 8 o'clock one. 40% of people in these small guys needed to augment end user capacity. That was that flurry of activity in the first 2 to 4 weeks. Oh my God, at home I only have a whatever. I have the middle price service. I want everything I can get so I can work from home. So there was a lot of end user capacity augmentation. And at least in the co-op side and the small side, the small guys report, there were no major disruptions or widespread congestion. Wow, there were still cable cuts. There were still cable cuts, guys. If we could just throw cable cutters in jail, that would be great. But okay. Now on the cable side, very similar kind of things. And here they talk about the fact that, once again, the upstream peak hours, did shift from sort of the late evening more towards afternoon, but still nothing peaked sort of at the late evening sort of thing. There was a larger amount of Wi-Fi calling and Wi-Fi data traffic, on your sort of cable environments. And, yay, CenturyLink, who is a backbone provider, no major signs of congestion. Go ahead, Laura.
That's pretty amazing, Catherine.
Yeah, we rock.
No, when you think about it, that's really amazing.
Yeah.
How people's lives were totally shifted, yet the backbone apparently just absorbed it. Yeah, it had peaks and valleys like that, but it's just amazing when you think about it. Wow.
So what were the key success factors? And this is at a strategic level. I'm not going to get down to little nits and bolts, but the key strategic factors is that our networks domestically are indeed engineered for peak demand. Okay, so they're designed for that 8 p.m. You're going to download Frozen 2. You're going to download whatever. It's designed for peak demand. Furthermore, and that peak demand engineering is also done at every layer in the nation, whether it's at the backbone, which is kind of a CenturyLink space. It's done at the transit level, where I'm sort of like connecting one co-op to another co-op to a mid-size. It's done at the content delivery networks, the Netflix content delivery network, the Microsoft, the Amazon content delivery network. And certainly down at the local, I'm in your home sort of level. So everybody sort of, builds for peak. And then we had the killer app, which was the fact that, and I put note the cable guys for this one. They call it the Wayne Gretzky rule, which is that you build to where you want to be. And most carriers, and the number might modify it slightly, but in essence, you know, what I'm building now, it's CenturyLink, is what I anticipate the traffic to be a year from now. So yes, not only did we build for peak, but I was also building in advance so that I had, you know, in essence, more capacity. Once again, we did add more capacity on like peering links and stuff like that, but still the fact that we had built for peak and then we build in advance, and it was, you know, March, so we were good, you know, 3 months in advance of that, is also very helpful. On the technical tool level, basic traffic engineering to balance loads, balance traffic. My backbone guys were telling me that things were kind of bumpy in Paris. And so they would re-traffic engineer portions of traffic away from Paris, down to Spain, up to Germany, over. So they would do that sort of thing so that, you know, you wouldn't in essence get off, you know, loaded down as much. So basic traffic engineering, coupled with, you know, the fact that many of these networks have really moved to a software-defined networking kind of environment, gave us the ability to sort of do the dynamic amplification and load balancing that was necessary. The last little thingy off to the side is the wireline guys, and what this is trying to demonstrate, and this is sort of to the peering links and to the big links, not the ones that are in your house, is that throughout the course of this thing, at no time did the capacity get beyond 60 to 73% of the peering links. Next. For those of you that like to see all sorts of cool charts, remember when I was telling you the government was asking, are you going to run out of traffic? Are you going to run out of, you know, capacity? All the major associations put together resources. So if you want to sort of see how they operated, you can do that. I will tell you that the NCTA one is terrific. The cable ones, you can put your state in there and you can see how it looks and how it did look. You can look at it. It's really fabulous. They were just like, you know, rocking. Now, this is all interesting, and yay team, we did a good job. But there was a lot of stuff underneath that I was talking about, some of the operational problems that I also think are worth noting, that we all banded together, mutual aid, mutual assistance, how we want to characterize it, to work. Go ahead, Laura. So there were a whole bunch of sector initiatives to work on behalf of, I think the rough number is something like 1,300 network service providers in the United States. I'm not counting the ISPs who are not, you know, like common carrier network service providers, but there's roughly 1,300, something like that. We as a sector sort of worked with all of these people. We worked at the White House level, CISA, certainly CDC, HHS, all the FEMA regions, and down to, you know, sending guidance and suggestions to individual states, you know, like at the governor level, the attorney generals, the law enforcement folks. We broke sort of our work down into sort of our ISAC work, which was the people who were, you know, getting things done, the Information Sharing and Analysis Center, versus the CSCC, where people tended to be just slightly more policy kind of oriented, so that we could have a breakdown of duties, so that, you know, in Kent's case, you know, Chris Oberg, who's his peer at the ISAC, you know, wouldn't go, you know, screaming off into the night going, enough. Mm-hmm. So these were the sort of the engagements that we're working with to sort of optimize our ability to keep things going. Go ahead, Laura. To give you a sense of the battle rhythm in the sector, and for CenturyLink, because we're smaller than AT&T and Verizon, there's only 2 of us, and we sort of do the full portfolio. We had daily operational calls with DHS, the NCC, and we had daily operational calls with the sector to sort of go, what's going on there, what's bubbling up, what needs to be addressed. The sector also had weekly calls with the major platforms. That's the YouTube, Zooms, Teams, WebEx, Netflix, Disney. I don't know if we were really happy the fact that Frozen 2 was released, and all these video games that I don't play, you guys would be able to tell. I mean, these are huge. These are, you know, these are backbone killing releases, and, you know, be able to have this kind of coordination with them sort of at a higher level was, you know, really helpful. We had a lot of opportunity to work, not so much work with, because it wasn't a problem, but we did a regular touch base every 2 weeks with our 2 lifeline sectors for comms, which is power and finance. Certainly all the cross-sector calls that, like Tom and your guys were, you know, the FEMA ones, the COVID-19 ones, U.S. Chamber calls. And then there was other ad hoc, government engagement, in particular with our favorite, regulator, the Federal Communications Commission. Go ahead, Laura. So very briefly, I just want to touch on two things. There were key sector inputs and outputs with government in partnership about all these 8 issues, whether it was freedom of movement in the early days, the essential critical workers, permitting, the performance tracking, so you had pretty maps so you didn't freak out, getting distribution of PPE. In particular, we as comms, we arranged and we were able to get 2.1 million face masks. And because FEMA and whoever was sending them out couldn't send them in boxes smaller than a lot, in essence, our associations throughout the nation took on they shipped all the lots to the association, and then the associations, for instance, in TCA, sent out all the masks in 5s and 10s and 20s to all the co-ops throughout the country. We spent a lot of time doing deconflicting all the rules, a lot of stuff on the hurricane season, which kind of brings us to now. And the most recent project that we just finished is the sector's return to normal guidance and resources. And I'm just going to touch on it briefly. Go ahead, Laura. So any of you who are dealing with this right now, you know that it's a Rubik's Cube in terms of what to do and how to do and what to do on it. And there's all sorts of guidance, there's all sorts of public health data, and there's all sorts of things you have to take into account. Go ahead, Laura. So we put out for the sector sort of a return to normal guidance. And this guidance is done, it is evergreen. It was released on the 1st of July, and it's designed to handle these major clusters of questions. What are the key planning? How do you deal with employee testing? What's the, the guidelines for workplace social distancing, blah, 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 blah. What's cool about this document is that when you go to the document and you pull it up, you can click on it and it'll take you straight to the resource or to the rule or to the guidance that we're speaking of. So it'll remain evergreen. I've given only 2 snapshots, one for employee testing and one for, because we're industry, or at least many of you on the phone are industry, sort of the liability issues. Go ahead, Laura. So in the employee testing, for instance, it'll answers the question about, is testing for reentry? What type of testing? Is it available in the community? How will they be handled? Go ahead, Laura. What if they refuse? So it deals with guidance along all these questions. And the good news is that as you're going through the book, as they answer all these questions, again, there's a link you can click on and you can go to the resource. Go ahead, Laura. And you can go ahead. And then the last one, and I think that this is why everybody's freaking out across the country about what is return to normal, is because the company holds the liability if anything goes wrong to its employees. So this is just one snapshot of some of the things that in particular, will impact many businesses, but in particular might have telecom aspects about, what kind of liability protections you might have to take of, how would you get waivers, all these, how to evaluate your insurance policies. And once again, this guidance is done. So if you click on it, you can sort of get it and hopefully make it easier for your company. It's been a busy couple of months, and I'm now going to turn it over to Kent, who's like a practitioner. Back to you, Laura.
Okay. So I'm going to go ahead and open up back to the All Hazards Consortium slides where we were asking the questions. And Catherine, thank you so much for that information. And Kent, I see you've unmuted yourself. So let's go back to the operational impacts. So Catherine talked a lot about how the pandemic has changed the way that she does business, although CenturyLink was extremely prepared for the growth and the rate increases of usage. So what would you say from your perspective was the biggest thing that the pandemic had on your particular organization?
Well, I'll try to build a little bit on what Catherine has already shared, in the fact that all of this work was going on, and like many of the people listening in today, at the same time we were moving the vast majority of our employees from working in our offices to working remotely. If you combine office-based employees and call center-based employees that we moved to work from home, and then our field operations teams that we used to send to what we call garage work centers to dispatch out, and move them to dispatch from home or home dispatching, or a much more distributed model to sustain the operations. all of those things that Catherine was talking about was going on at the same time. We were completely reimagining the business and the way we do operations on a daily basis. In the course of about 2 weeks, we shifted almost 100,000 people from working in a traditional office or garage work center to being either home-based in one way or the other. So a lot of complexity that goes with that, understanding the technical requirements when it comes to, it's easy when you've got a knowledge worker who has a laptop and can go home and start working right away. More challenging when you start talking about people that traditionally work on an ACD or with thin client type technology and needing to make sure that they can do their same work on a daily basis from home. That came with the need to ramp up our VPN infrastructure for our internal use, as well as ensuring that all of the cybersecurity practices were in place to protect all of that work that was being moved from home or being moved to home. And I'm sure that many of the people on this call went through some of those same exercises as they were shifting the way they were operating. A couple of other thoughts that go with that is, Catherine talked about the need to understand what was happening in the network. And really a lot of that was leveraging our data scientists and using big data to analyze what was happening within the network. It's easy to talk about network capacity at the macro level, but the piece that goes underneath that is you really have to understand down to the segment level where you're seeing that traffic, where you might be seeing potential for congestion, and that in advance of that congestion becoming a problem, adding additional capacity to those network elements that Catherine talked about. So we were doing that to make sure the broader network was robust and healthy. And at the same time, you have customers that are making these same transitions and coming to you looking for assistance in expedited adding of capacity to their data networks, to their security practices and what have you, to support the shift that they were making to home at the same time. So all of those things had to happen simultaneously. Catherine brought up a great point in the fact that there was a lot of work around personal protective equipment and deciding not only what we needed for our employees, but how we were going to source it, how we were going to distribute it, and how we were going to train our people to continue to use that personal protective equipment as we move forward. So a lot of work that had to go into that as well. And, Catherine raised a great point in that you have to do that analysis of what are the state or regular or regional requirements for use. What are best practices that you are going to implement because you think they're the right thing for your employees, and then bringing those all together in a coherent policy that you're going to implement within your organization. One of the things that we did do very specifically around policy is that we stood up a core team of senior leaders with representation from our HR team, from our labor legal team, from our operations organizations, where we could really focus on that policy work and make sure that we were quickly making those pivots and creating policies that were going to get us through the response to COVID-19 and make sure that we could do it in a rapid and agile way. So considering how you're going to, develop those policies, your internal policies. Catherine talked about industry policies with the federal government and what have you, but those have to translate into company policies for yourself, how you're going to write those, get them approved quickly, and then be able to educate people on them and implement them. So all very critical work that was happening during that first 2 months of the response, and really continues to go on today, as I'm sure all of you are seeing with challenges that some regions of the country are having with containment of the virus. there's that ongoing flow of executive orders that are coming out and that need to be assessed and need to be, if needed, you need to refine and adjust your operating protocols or practices to make sure that you're in compliance. So having a thought out process to do that and make sure you're keeping up with all of those ongoing changes that continue to come out is going to be, from my perspective, one of the things that we will all be challenged to stay up with over the next month or two as the situation continues to develop here in the United States.
Thank you so much, Ken. I'd love to touch on the cybersecurity that you brought up and making sure that your employees follow the practices that you had put in place. When the pandemic started, did the plan in place you had still hold true? Did you need to add to it, edit it to cover any issues that dealt with the pandemic? I know that's been a lot on people's minds and how vulnerable we are since the pandemic happened to cybersecurity attacks.
So,
Ken, I want to do a history check. 10, sort of like during avian flu, so 2008, something like that. Something in that time frame. Actually, I worked with your predecessor, Kent, all the major carriers. We did pandemic planning. We did it as individual companies. We did it, as a sector. We did it with the U.S. government. The financial services folks did it. And actually, I do give credit to us having done that planning, about a decade ago. Having said that, and I'm going to quote one of the financial services folks. He goes, but you remember that? The plan was that maybe 30% of the people would be home, and it would be like for 2 or 3 months. Because we're at the 100%, and it's been since March. So, but does that hold us over and sustain us? I think that gave us an immense leap ahead over the people who had not. Sorry, Ken.
No, I would absolutely agree with that. And having those essential building blocks in place, it was extremely important to be able to make the transitions that we did. So, Laura, I would tell you that we had the right cybersecurity practices and programs in place, needing to reinforce through employee training about some of the types of activities that we were seeing out there. Catherine, brought forth the idea that many of the criminals pivoted to try and take advantage of COVID-19 for financial gains. So being able to reinforce training that we had already done and having the right network security elements in place was critical. Needing to continue to build on that and be hyper vigilant for that type of activity has been extremely important over the last few months and will continue to be so going forward. That was for our internal use, but then also supporting customers where we help them with their cybersecurity practices was also a key piece of the work that was going on over the last few months.
Laura, it's worth mentioning, and this is not COM specific, but what we are observing and what we have gotten in terms of, better understanding from sort of like the FBI, US, CERT, whatever. If we as a nation are vulnerable at all right now, it is because, unlike, let's put it, many enterprises has sort of a work from home practice, and they had sort of figured out how to extend the enterprise security to the home endpoint, if you will. And in that case, they already sort of did that, and they just sort of copy pasted for not just 30% of the people, but however many percent of the people were working from home. Many, many, many companies did not have that in place at all. So for companies who have not sort of thought about thought about extending their own enterprise's security to a work from home environment for their employees, they are definitely scrambling. And this is something that I think everybody is putting a full laser focus on, because you don't want to be, you need to keep doing your business or else you're going to go out of business. On the other hand, you don't want to be taken down by people who are obviously going to be taking opportunity to, like, let's see if we can mess them up. So it's an important element right now, currently, in terms of operational risks and operational impacts.
It sure is. Thanks so much, Catherine. And to our listeners, I do see your questions coming in. I promise we will get to those in just a little bit. Keep them coming. Panelists, I'd like to move on to the second question. How have you addressed the issues that we talked about just now since the outbreak? And tell us a little bit about the initiatives you've taken. Catherine, I know you talked about this in your slides, but is there anything that you want to add to this particular aspect of what your group did to respond to the situation?
I think the things I've already sort of outlined were sort of like my role, my responsibility on behalf of my company and the sector more broadly. I think Kent has really sort of spoken to sort of like, what have you had to do to sort of make sure that your employees are taken care of? So I don't know that I have much more to add to this.
Yeah, and Ken, you talked about building the core team with legal and HR, et cetera. Is there anything else that you'd like to add to this particular?
Sure, I'll add a couple of quick points for everyone's consideration. First, our business continuity plans have served us very well through this event and really helped us, make that transition from working in the office to basically working from home. I would tell you that one of the things that we had to do after we executed that move is go back and work with all of our business units and reevaluate those business continuity plans and put in additional recovery strategies. When the primary recovery strategy is to shift your people to work from home and you're already working from home, you just need to make sure you've got the additional plans in place to recover if you have an impact from a hurricane or another event when you're already in a work from home status. So something that everyone might want to consider as far as that goes. The other major area where we've done is really had to go back and look at all of our operating protocols and see where we can move to, touchless interactions with our customers to try to help protect our employees and reduce the spread of the virus. And a huge amount of work by our retail team to really take that and re-envision the way that they are able to serve our customers while trying to reduce interactions. And the same thing for our field operations teams. The ability to have a field technician stand outside and use a smartphone app to see inside of the customer's home and help them fix their own problem is another great example of the kind of work and innovation that's been put in place since the beginning of the pandemic. And then I would say finally, partnering with our customers as well and trying to put into practices to have a conversation with them before an employee goes out to make sure that, one, they understand what our protocols are to help protect them, and then make sure that they're in a place where it's okay for us to send an employee in as well. And having that dialogue before we go to a customer or a business location has also been a important piece of the way we're trying to help the communities that we work in. I guess the other thing I would just add on, and probably an item that doesn't get quite as much coverage, is we do see a critical role that we play to support the communities that we serve, and working with first responders to make sure that they have the telecommunications support they need to do things like stand up mobile testing stations, to stand up quarantine areas, and to make sure that they have the communications to support the command and control for public safety throughout this event has been one of the main things we've worked on as well. I think at this point we're coming up on 450 missions where we're supporting different public sector agencies to serve the communities.
That's great, Kent. Thank you. You talked about enhancing plans during the pandemic. I think I heard you say that you're also exercising still those plans.
Absolutely. One of the things that we did take a pause on is our annual planning program. But as we made that transition into our new normal operating model, we've resumed that normal planning program to include our traditional annual cycle of updating our plans, exercising them, and taking a close look at all of our emergency response processes to make sure that they are still viable in a COVID environment where social distancing is the new norm, and making some adjustments on the way we're going to conduct our internal operations, and then make sure that we're ready to work with the communities that we work in to understand how they want us to be there. In some instances, places where we would typically have a physical liaison, they would prefer to have a virtual liaison now. Or if they do have a physical liaison there, understanding what their protocols are going to be for safety and the PPE requirements, so that we can effectively support them in that way as well. That's
great. Okay, thank you so much. Let's move on. You both talked about your partnerships during the process and being successful in meeting your mission. Was there any partnership that may have surprised you during the past 3 months? Anyone who approached you or you needed to approach?
I work primarily at the federal state level. And I think I've kind of run through a full portfolio of sort of partnerships. The new partnership for us at my level now was with the major platform guys, and that was kind of new for them. Now, to make very, very clear, all those companies, the Zoom, the Microsoft, blah, 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 Netflix, Verizon already has a business relationship with them. I already have a business relationship. They talk to each other every other week about, scaling up capacity so we can keep things balanced and loaded, and within the sector, we have always done the sort of kumbaya amongst each other, so that when there's a hurricane or a tornado or, COVID, that we know how each other is doing. And we in essence do they are the first people that we sort of reach out to. Does Verizon need help? Because if I fix Verizon, then Verizon can fix 10,000 people, that kind of mutual aid. So bringing in these platform folks to have that dialogue, not at the contractual level, but more at sort of the 10,000 foot level about, okay, Disney, yay on Disney Plus in Europe, yay on Frozen 2. Do you have concerns about, they were able to ask us, do you have concerns about us doing Frozen 2 on such and such a date? Do you have us concerns about, and I can never remember the name of those games that EA does, to be able to have those kind of conversations, not just contractually, but sort of more broadly, to let's say the top 10 plus carriers, and to sort of have that, and literally it was just a conversation. It was like, we're thinking about this, we're not thinking, are you guys good with this? Do you have any concern? Really, that was sort of an interesting kind of sector to sector partnership, which I don't think that the IT folks had ever done before in the past, but they seemed to find it of high value. I know we found it of value. So that was an interesting on-the-fly partnership, which candidly I think will extend for post-COVID.
Yeah, that's very interesting. I would have never thought that you had to coordinate. I mean, it makes perfect sense to me now, but that's really interesting. Thanks, Catherine. Ken, any input on the partnerships?
Yeah, I'll throw out a item for everyone's consideration, and that's the use of industry groups, similar to the SICE, but we found great value in listening to and learning about the approaches that other industries were taking, be it through HR groups, through employee health and safety groups, through industry groups like the SICE, and really giving us an opportunity to understand and learn what others were doing and consider how they that approach may or may not apply to the work we were doing as well. At the end of the day, we've done, I think, a very good job of setting an extremely high standard for our employees when it comes to safety, while still maintaining the ability to support our customers. But a piece of that analysis and the development of those policies came through that benchmarking we were doing throughout March and April to understand what other people were doing as well.
All right, thank you so much, Ken. Our next question deals with innovations. If you can tell us some innovations and solutions you implemented or even considered to developing a more resilient service for your stakeholders. Catherine, I'll start with you.
Well, Kent pinged on this, but I tell you, the how to do installations in a consumer's home without going in the home has now become an art form. I mean, it's just stunning. All of us have done it in one way or another. But what's really, really nice is when you see, like, YouTubes or Facebook postings. And look, Jack came over to fix my this, and we just talked it through, and it was sort of like a win-win. I scored because I could figure it out, and Jack was outside, he was leading. I think that was, from a user experience, a customer experience, as awkward as it was in the first, like, say, week or two, has ended up being a huge success story for CenturyLink. I understand it's been a big success story for Verizon as well. So I think that was a major user experience innovation.
Absolutely. Kent, anything to add?
I think the thing I would just revisit real quickly is the touchless retail and the ability to support customers throughout this event while trying to increase their comfort level by reducing the physical interactions that had to take place. I think that's going to be a piece of the way we do business going forward as an option for customers. So that's the days of cash or even credit card in the store are going to continue to decrease, and in a lot of ways now we're letting people pay online either when they're in the store or on their smart device while they're in the store versus that traditional transaction. So that's been another one in addition to the type of work that Catherine talks that not only we implemented, but CenturyLink and some of the other major providers. It's been another opportunity to leverage our use of AI and big data to really take our ability to analyze the network and see how the network was being used and where we might need to modify or enhance the network to ensure that we were staying well ahead of demand. Another way that I think that it's an innovation that we put in place and will continue to serve the company well after COVID is hopefully gone in the near future.
All right, thank you so much. Catherine, what's next? How are you planning for the weeks ahead?
At this point, I think there have been enough iterations of sort of go, stop, go, stop, go, stop, that at least at CenturyLink, I think we kind of have that groove down. Let me be very precise. The people who have to be out are out, our technicians, people who have to be in a closed environment. Everybody else is working from home, and we're doing it globally because, we are global. And so we've been dealing with COVID since Asia, okay? So, and we anticipate sort of staying home, or there's just no reason to really go back.
Right.
So when we're talking about how are we planning for the weeks ahead, the real question is who has to go back? That's the real kind of operational question. So planning for us now is more on the human side. So, and I think Kent might have started to tease this out. For instance, how you manage people within a company when you're not in the same room is different. So, how do you manage people? How do you do pop-up manager meetings? How do you have staff meetings? So it's now back down to how do you do business differently? So is that planning? Yes. It's sort of, tweaking the resolution of how you've always done work, but now doing it in a different environment. So I would say that right now, it's not like we're planning for the next COVID per se, but now we're sort of like, let's drill down and how do we make this we're already doing well. How do we make this as optimal for, all our people across the globe so that they're still connected, so they're still getting their work done, so they still feel like they're part of the team. That's where I think most of our effort today is.
Right. Thank you, Catherine. Kent?
A couple of quick thoughts. First, as we look ahead, and I mentioned this before, it's starting to take the lessons learned from COVID-19 and understand how we're going to modify the business past COVID-19, because we do see some opportunities to refine and improve the business based on what we've already learned. The second piece is, starting to prepare our facilities for the eventual return of employees and deciding how we are going to implement social distancing within our physical locations, continuing to monitor and ensure that our safety protocols are serving us well today, and that they will serve us well as we begin to return some employees back to the office. You know, very similar to what Catherine says, we're not looking to rush back at this point. And in fact, a few groups have actually gone ahead and made the decision to move to a work from home environment going forward. So, you know, trying to make some of those changes, and that does require a little bit of work also when you make those permanent decisions that, you know, does a person have the right equipment, internet access, et cetera, if they're going to be a permanent home-based agent versus a temporary home-based agent because of the response to COVID-19. The other thing that is an ongoing work stream for us is understanding the containment of the virus in all the geographies that we work in, not only here in the States, but at the international level as well, and understanding the ongoing evolution of the executive orders that come out and making sure that we are in compliance with all those orders. We're, you know, reviewing multiple orders a day to make sure that we're meeting those standards. You know, we've, I think, done a pretty good job in the fact that most of the orders, we don't have to make any changes because our internal policies exceed the standards of the executive orders. But in a few cases, we have to make operational changes to make sure we maintain compliance with those orders as well.
Right.
So
that makes perfect sense. All right, thanks so much. And this is our last question, and then we'll move on to Q&A. For our listeners out there today, any recommendations or resources that you can provide so that they can improve their own resiliency? Catherine?
Because you have such a diverse group, I definitely would say that you need to double down on thinking about certainly the security of your essential mission being done work from home. So if you didn't already have a, endpoint security, you better have one now. That would be where I would really be focusing my efforts. If I were just a generic enterprise that was trying to lock that sort of thing down. There are indications that this is going to be long-standing. There are indications that what was like going to work in a big city like New York, maybe not so much anymore, and maybe they're going to move to the suburbs or to more rural areas. So being able to assess whether or not your end user, the employee that you're trying to work into your, environment has the right, accessibility to broadband, has the right security, I think is going to be a major, should likely be a major focus, maybe not the only focus, but a major focus of efforts for the enterprise for the next couple of months.
All right, Catherine, thank you so much. Ken?
I would talk about the relationship with our customers, and I'm sure, very similar for many of the folks on the line here, having that ongoing dialogue with your customers to understand how their business is changing and how it might impact the demand for the services that you provide, and also help you anticipate how we were going to need to change our businesses going forward to, account for those things. We talked about the changes in the demand on the telecom network as we began the response to COVID-19. As we go forward, there's going to be more changes in demand. As to Catherine's point, people move to more distributed models. They shift out of major metropolitan areas to maybe the suburbs. There's going to be a lot of change that I don't think we can fully anticipate at this point, but having those ongoing conversations with your customer is going to be a huge resource to help understand and decide what changes you're going to need to make as you go forward.
Good advice, Ken. Thank you so much. And those are all of our questions for our panelists. Catherine, Kent, thank you so much for your feedback on the information today. It's really interesting. And I'm going to remind our listeners, if you'd like to submit a question, you can either do so through the chat or through the Q&A window, and we'll get to that in just a minute. Tom, I'm going to turn it over to you for some closing remarks.
Yeah, really interesting. I was just making some notes, Catherine, as you and Kent were talking about, trends like what's coming, like being more predictive in planning. And I think that's a big one. Urban to rural has been a trend, and I think it's accelerating, to your point, which was a great point here as well. Like Laura said, this will all be recorded. We have a library of these. If you register for the sites, we're going to let you have access to that. But I wanted to thank Kent, you and Catherine for showing up and doing this for us. This is really, my head is going a mile a minute here. This is kind of where we all live, right? And I just was quite impressed with the possible things that can come out of this one in the future. So, Laura, if we're good, we'll just jump into some questions. We got a bunch of them here, it looks like.
Yeah, and I was able to pull that up, Tom. So I see a question here from our friend Robert Trout-Massey. Will the U.S. Communications Sector Coordination Council update the return to normal guidance as we transition through the COVID response and recovery phases?
It is our intent to do so, but it just got released July 1st, so don't hold your breath for next week, okay? But most of the links are evergreen. So to the extent, for instance, if something links you to the state of Arizona, as Arizona updates it, obviously the document will also update.
Okay, thank you so much. Here's a question from Tom Lockwood. One of the ongoing challenges of incidents is reporting and information sharing, specifically regulatory versus industry. Can one of you discuss the general challenges, key issues, lessons learned, and the role of the SICE evolution over time?
Well, let me jump in and share a couple of thoughts. I am a huge believer in the ability to take diverse data sets and when there is an operational challenge during an emergency, be able to combine those in a way that helps create clarity and drive decisions for your operation. The SICE is a great example of that work and being able to take those diverse data sets and create better clarity, which will drive better decisions and a faster recovery for your business. I would assume also that if you're not doing that internally already, that the ability to foster some of those internal data sets and combine them to paint those operational pictures extremely important, and a building block that will put you in a position to choose what information you might be willing to share across industry sectors or within the industry to help with mutual aid and collaboration during a response. So it is an evolving body of work, which I think that Hurricane Michael kind of reinforced the importance, and we continue to find better ways to share information as we go forward.
Ken, thank you so much. Tom had a second question. NIST has asked industry for comments to digital identity standards in the US. COVID prevented execution of certain processes and drove operational changes. Any identity or credential recommendations or impact contacts to include in this work or these discussions?
Essentially didn't have any experiences like that, but I can share that in my discussions with people in the telehealth organization, and this will just be a super top line assessment. Apparently, many telehealth environments are really designed to sort of connect a physical location in, let's say, a rural town to some larger facility, sort of like point to point. And there are very rigorous rules around both the connection of those points as well as what can be shared and what can be shipped among those points. Well, when COVID hit, apparently, and I'm just telling the story as though we're at cocktail hour, okay? Apparently is that people needed to go to these places to actually be treated. Right. And as I understand it, the healthcare sector did a huge lift to be able to change and modify some of the identity-related security measures so that they could be in a better position to, in essence, treat through telehealth mechanisms people who were impacted. So nothing specifically for CenturyLink in terms of identity per se, But I think there's some good stories if you probe other sectors for how that might have impacted them.
All right, Catherine, that makes sense. Thank you so much. Tom, thank you for the questions. And before we adjourn, I just wanted to let people know that the All Hazards Consortium is working on our next virtual discussion, which will be sometime at the end of the month. We haven't picked the date yet, but we'll let you know. This one's going to focus on aviation, and we'll have the Portland International Airport as well as Allied Universal, and a third panelist yet to be named. I also wanted to give you my email address, which is laura.johnson@ahcusa.org, in case you either have a solution that you want to share with our users, if you have a webinar idea, or if you have any questions for us. I'd like to thank our panelists for participating, and if we have a few minutes, what I'd like to do is open up the discussion line. I'm going to start promoting the participants to show their video if they'd like to unmute their phones and say hi to us.
Laura, while you're doing that, I got a question for Catherine and Kent. How did you see the pace pick up and the bureaucracy slim down during COVID? We noticed a lot of barriers vanished and the pace picked up tremendously. I was curious if you all saw that in your respective roles.
I'll speak at a higher level, and Kent will I sort of like to do it at sort of like, feet on the ground kind of level. What we noticed is that actually, the first couple of weeks we were fine, but it was as everybody else sort of figured out, oh my heavens, what do we have to do? That all of a sudden everybody was second guessing what the rules of engagement were.
Right.
And I'd say that churned for 3 to 4 weeks.
Okay.
And then everybody buckled down and sort of remembered, NIMS and ESFs and stuff like that. And then they kind of got squared away. But let's face it, this was one nationwide. People that don't normally see hurricanes, all of a sudden they had to respond. Many businesses who have never thought about this kind of, BCDR kind of planning, all of a sudden are confronted with it. So, it was a huge, I think, lift and a lesson learned, and having to pivot quickly nationally. And, so the fact that we recovered so quickly, I think, is probably good.
Yeah. Kent?
Yeah, Tom, I would tell you that we saw an incredible increase in pace as we went out of February and, well, really in January into February, as we saw, first the instances in our operating countries in APAC, and then EMEA, and then the stand up of our global crisis management teams. That has gotten a little bit better. I would tell you that the bureaucracy has decreased, but as we've continued to evolve the operation and look for the next thing that we need to be focused on in order to protect our employees and support the customers, that the pace is still pretty brisk right now. And I don't see that changing anytime soon, as we continue to have a very dynamic environment with the containment, and in some cases lack of containment of the virus, and then the ongoing regulatory requirements that we're seeing as well.
Right.
So a couple of thoughts on that one.
Okay.
Okay, Tom, so I have promoted everyone to be a panelist. So if anyone would like to unmute their phone and ask a question that way, or even just introduce yourself and meet our panelists, we welcome you to do that. Don't be shy.
Hi, everybody. This is Tom Lockwood. I'm over with the Secure Technology Alliance and our subchapter organization, the U.S. Payments Forum. We have about 90% of the U.S. or North American payments. And what we found is roughly 25% of the cash market has moved to the digital environment. We don't see that changing. But that's something, just as people are looking at the major trends. Generally, when people want to make a change in their life, it's usually about 21 to 27 days in a row of change behavior. We have now locked up everyone for 6 months. So some things that people think about their transactions, how they do business, have substantially changed, and they're not going to go back. just as a common point. I did raise the issue with regard to identities. Catherine, you were absolutely spot on. Thank you. That was absolutely correct. We were working with the Health ISAC, but some of the issues that we see is the identity between persons and non-persons. We have cybersecurity issues related to, you know, if you would, everything from devices like dialysis machines and respirators at home, sharing information, if you would, some of the key HIPAA issues. So a challenge that we have, you know, there is, again, are the people systems who, you know, are they who they claim to be, and the interoperability of those? That's been a very active part that I think that you all would want to know. The other issue that I was raising is with regard to data interoperability. Since we're cutting across every sector, some of the key issues are, how do we unlock data? What are some of the choices to how do we share that in, if you would, the split piece? And I guess, you know, Kent, you had raised this one, and it's this ability to say most of our information sharing and systems are built around either operational processes or regulatory processes. And in incident time, you need to pick and choose the kind of information to get either a better tactical understanding or better information to share. Some of it we really do want to share through SICE that we can locally as a community, and how do we again reduce some of the analog reporting that we do. So we're, you know, our community is looking very actively at those things. If you have any other recommendations on those, either for the group today or later on, we'd be happy to integrate that into the pieces that we're working now.
Thanks, Tom. Anyone else want to say hello or ask a question to our panelists before we adjourn?
Wow.
Tom, I see a lot of familiar faces, though. It's nice to see our friends back with us today.
Just a comment, you know, communications is one of those things that you just take for granted. It's like electricity. You throw the switch on, you pick up your phone, you dial, you just take it for granted. And it really is a testament to the, I guess, the planning and the investment as we go on as a country, right? This is pretty amazing. I was really taken back, Catherine, by your stats, right? That's pretty amazing when you think about all the people that had to, over literally within probably 3 days, I'm not going to work today, right? Oh my God, the schools are closed. Now I got to watch kids, right? Now I'm going back to work. No, I'm not going back to work. I got to watch kids and go back to work. You know, Laura and I talk all the time. We're trying to figure out if anybody's addressing daycare. You know, this concept now that moms, dads are home with kids and now they got to work for a while. I think, Catherine, you said this is going to be a while. This isn't going to be a little, you know. And anyway, how fortunate we are to have this infrastructure, and it stayed pretty stable amidst all the craziness. So what are you doing to protect workers? What types of things have you planned on for the people that are, you know, going out into harm's way? The reason what bring that on is I just got off a call. Electric sector is getting ready to respond, right, to hurricanes and things like that. And they got to move fleets, as you all do in the comm sector, across states that have restrictions, right, or into states and then back to a state.
Actually, they're exempted from the restrictions, but they have to report. Okay, just for the record.
Yeah, that was what I wanted to ask you. What are you hearing, or what are you preparing or seeing at that front?
The electric sector in particular, and this is just my understanding, it's not precise, does a lot more long hauling, if you will, than we do, and they do it cross company a lot more. It's not unusual, obviously, for AT&T to drive down from New Jersey to hurricane season, or for Verizon, you know, but it's not like XYZ company is going long country to help out LMNOP company.
Right.
Instead, that kind of interaction happens generally within market, within states. So, you know, if there's a problem in one of my states, you know, I help whoever's there and vice versa. So they have slightly different scale issues than we have. We have the same issues, but just on the same scale. But no, there's a lot of discussion about, to what extent is there an apportionment of, let's say, the open hotel rooms for people who are fleeing the hurricane versus people who will be there for, 20, 2, 3, 4 weeks, and I will give credit to the operational folks who have been doing a lot of work, particularly with the hurricane states, to sort of create some nominal process so that it's understood how they will apportion that out. It is going to be a major hurricane season, though, so I think we'll break a little bit of new ground. Kent, what do you think?
Well, a couple of things. I think you have to start thinking about how you're going to train and ensure that all of your employees are practicing the basics. And when I think about basics, I think about social distancing, the use of personal hygiene, which, I include hand washing and cleaning equipment. If you're talking about an office space, that you have the right cleaning protocols in place there and that you're using those all the time. The other thing you're going to have to do is make sure you understand the areas that you have to traverse. Catherine, you're absolutely right. The majority of states have provided exceptions for critical infrastructure providers, but that's actually not completely universal. So you have to make sure you have that good understanding of what the executive orders are calling for your industry and for the specific turfs that you're going to have to traverse, because that may impact either your route selection or your decision on how many people you're going to deploy into a given footprint, with the understanding that you're going to lose them for 2 weeks when they come back. In most cases, we're fortunate enough that we don't have to do a lot of shifting of workforce and able to facilitate a response, but always something that everyone needs to consider. And then also, how your partner is going to be operating in this environment. For us, it's understanding how state and local EOCs are going to operate and how that's going to change our liaison program. And in some cases, how we may need to interact with our partners in the commercial power industry as well, because we often try to coordinate and sometimes have liaisons with them as well to try to minimize post-storm damage as well. So just a couple of thoughts to share with this team.
Some thoughts for both of you to consider. What we're being asked is for both contact tracing back through mobile devices, and we're looking to say they're looking for digital tokens on tests and testing. So whether that's boarding an aircraft, have you had a test within X number of days, or two negative tests within X number of days? Tom, that would probably be something when we think about mutual aid packages, when people travel, just one of those things that if we're doing tokens and people can authenticate it, it's probably something for people to consider. But there's certainly conversations of when you really reopen mass transit, especially on the air side. Some of our members, one of them, CVS alone, does. I'm sorry?
I said, next time we'll have to have you as a panelist.
Oh, no, Tom has me. I carry Tom's luggage, put it that way.
I don't know about that.
Just on one of our members alone, CVS, they do just under 10% of the U.S. testing right now.
Wow.
Thanks, Tom. Okay.
Yeah, I'm gonna.
It's probably a great point to build on a little bit, because I'm sure if you haven't already done some analysis and put a program in place, deciding how you're going to manage internal contact tracing and the policies that you're going to put in place around that, extremely important. And then once again, going back to the local executive order piece, there are some jurisdictions where we are required as a company to make sure we notify those authorities anytime we have a positive case within the company. So something that, just a couple of quick points to consider if your company hasn't already done so.
Yeah, I'm going to share in the chat a really good document. I know a lot of sectors have done different work, but I know the electric sector pulled all the trades together in a bunch of tiger teams, and they did this guidance documents for COVID, really complete soup to nuts, right? Procurement, reentry, PPE, mutual assistance. We're focused on the mutual assistance piece of this because it's a big issue right now. But I'll share that out with the group in the private sector. There's just a lot of good information in there for both small and large. They can use that that document. Somebody said something just triggered this, and this could be a good resource for everybody to know about. It's a public document, so it can be shared outside of.
Tom,
Yeah.
speaking of good information, Catherine, there's been a couple inquiries. If I can share your PowerPoint with the
Oh, yeah.
attendees.
Yes, it's TLP White, and the link for our COVID return contact that's in there as well.
Okay, great. So I will email that to the
Okay.
participants. Thank you so much.
Okay.
All right, any last questions before we adjourn? Okay.
Just, I have to do a public service announcement for my wife is make sure you guys sanitize these things, okay?
Yeah, right. Thanks, Tom. And Catherine and Ken, thank you so much for
It
your.
was my pleasure. My pleasure. Thank you.
Everyone else, thanks for listening.
right.
We really appreciate you being here. Have a good night and be safe.
Thank
Have
you.
a great night, everyone.
Okay.
Night.
Thank you, thank you, thank you, thank you.
Bye.